I think we're going to go ahead and get started. My name is Siobhan Roberts, and I'm with St. Francis Corporate Communications. Welcome to St. Francis Medical Town Hall. We've got quite a crowd this evening, so we appreciate you being here. We have Dr. Ryan Parker, who is our moderator this evening. She is Associate Chief Medical Officer of St. Francis Health System. And then we have Dr. A.J. Joseph, our presenter this evening. He is an interventional cardiologist with the St. Francis Heart and Vascular Institute. So thank you again for coming. We're glad you're here. Welcome to the employees who are here this evening. And I think this is a record number of employees that we've had attend a medical town hall event. So I'm going to hand it over to Dr. Parker.
Thank you. I'm going to actually, the podium mic is on, right? Is the podium mic on? All right. Well, thank you, Siobhan. I'm so happy to be here and so happy to see this great group. I get to introduce my friend, Dr. Joseph. I have been working with him in the ER now for the last kind of 4 or 5-ish years, sending him my patients, but consider him more than a colleague. He's truly a friend. Just to tell you a little bit, he's a very smart guy. To tell you a little bit about his training, he attended medical school at the Calcutta Government Medical College, and then did his residency at Cook County, and followed it with a fellowship at Tufts University and Rush University Medical Center. So really prestigious places to learn and grow. While he was there, he got to be around one of his mentors, Dr. Kim Allen Williams, who was chief of the division of cardiology at Rush at the time. And Dr. Joseph noticed, when he was a guy growing up in India, he had a diet that probably was similar to mine in East Texas, that included lots of meat, eggs, dairy. Mine included lots of hamburger helper and frozen fish sticks, so I'm not sure if they had those in India, but all not quite the healthiest of options. And that diet obviously follows you. What starts when you're a child follows you into adulthood. I lived on Hot Pockets in college, so you start some patterns that probably aren't very good. So while he was trained to be a cardiologist and helping his patients clean out their arteries, he noticed that his were getting clogged. His cholesterol was going up and couldn't get it down. So he starts thinking, gosh, I'm a smart guy. What's the deal here? So his mentor, Dr. Williams, kind of introduced him to the cardiovascular benefit of a plant-based diet. And so the advice Dr. Joseph was given at that time in his life was that you didn't need more pills or more testing, but to shift his diet to mostly plants, vegetables, fruits, seeds, nuts, whole grains, and to incorporate regular exercise and good sleep habits. All very simple things that we have easy access to. So after changing his own lifestyle and seeing his health improve, obviously the next step is, why wouldn't I shout this from the rooftops and help my patients? So Dr. Joseph completed more training and became certified in lifestyle medicine at Cornell University, and then certified in culinary medicine at Harvard. And so the lifestyle medicine specialty became a medical subspecialty in 2016, and it prescribes lifestyle interventions as a primary way to prevent, treat, and even reverse chronic conditions. The American College of Lifestyle Medicine is now the fastest growing medical organization in the country. And I'm so happy to get to hear his talk tonight, and we are so fortunate to have Dr. Joseph with us this evening to share his knowledge. So thank you.
Thank you. Thank you. Well, thank you all for being here. All right. So here's the agenda for today. We're going to be, over the next hour or so, we're going to be talking about what are lifestyle diseases, what is lifestyle medicine, and by the end of this one hour, I'm hoping that you go with a clear understanding about what are these 6 pillars of lifestyle medicine that we talk about. I'll be sharing some latest data and research on what's happening in this field, some resources. 1 hour is not enough for us to cover the length and breadth of lifestyle medicine, so what I'll be doing is that sharing some resources, and some of these resources are outside as well, and hopefully we'll end with a nice interactive Q&A session. So before I just dive in, I'd like to talk about one of my favorite patient families. Jody and Don. Jody is a truck driver. He works for a fast food company, and he came in about a couple of years back in March or February of 2021 with chest pain to my clinic, actually to the hospital. So as the protocol goes, we did a stress test on him, and that stress test was significantly positive. Followed up with a heart cath, and what he had was a 90% blockage in the LAD, which is what we call the widowmaker. We put in one stent, and it looked fantastic. So I go back to his room after the procedure, and his wife is at the bedside, and she's like, "Just tell us, Dr. Joseph, what are we supposed to do, and we're going to do this from now on." So I gave them the booklet that some of you have seen outside, and they're like, "You know what, we're going to do this." So they were all went fine, and they got discharged. And a few weeks later, he comes back in again with chest pain. And so we do the whole drill again, and fortunately, we had to make sure things are okay with the stent, and we do the stent, we do the angiogram again, and things are all fine. And then when I go back to the room, and what we just discovered was that he's under a lot of stress. He's under a lot of stress from work, things that are happening at work and all that. So what it was basically he came in because the stress was too overwhelming for his heart. And that's what I'll be talking about in one of these the slides going forward. So we worked on a strategy of stress management, and I'll come back to him again at the end of this presentation. But let's go back to why we're here. Chronic diseases, lifestyle diseases, are basically heart disease. 80% of what I see in the office is coronary artery disease. Cancers, diabetes, stroke, Alzheimer's, these are the leading causes of disability and death. 6 in 10 Americans have a chronic disease. 4 in 10 Americans have 2 or more chronic diseases. Every second person has cardiovascular disease. That's how big the problem is. 72% of Americans are either overweight or obese. 88 million Americans as of today have prediabetes, and the sad part is 90% of them do not know that. So that's the scale of the issue that we're dealing with. Now let's talk about heart disease. So what you see here is a graph of age-adjusted heart disease death rate over the past 20 years. Around 2009, the 1990s, 2000s is when we started to have these STEMI programs. What are STEMI programs? Are basically when you come in with a heart attack, there's a certain protocol that we follow. Within 60 minutes, you got to get the patient into the lab, open up the blood vessel, and things like that. So that's when these programs started coming into existence. And around that time, beta blockers, statins, these medicines that we know are good for the heart, they started being more prescribed. And around that time, we started to notice that this death rate started to go down. But if you see around 2014, 2018 is when that death rate started to plateau. And that's where the news gets worse. This is the death rate for Oklahoma. So if anything, things are going the wrong direction here as of today. So in fact, thank God for Mississippi, because we are 49th in terms of heart disease death. So that's how bad the problem is, especially when it comes to heart disease. So this is a picture that I show my patients when I do a stent on them, right? So we can put in stents with 2 millimeter blood, like 2 millimeter holes, and fancy ultrasounds and things like that. But literally what I'm doing is basically just mopping the floor while the faucet is open. And so that's what I tell patients and our families are that we just clean the mop the floor, but we got to close that faucet as well. And literally that's what is lifestyle medicine. We're trying to address that root cause of heart disease, strokes, cancers, diabetes with an evidence-based approach. And that's important because in this day and age of information overload with YouTube, Facebook, you've got so many people talking about whole lots of nutrition fads these days. So it's very important to understand the concept of evidence-based. A lot of what you could be hearing over the next hour is evidence-based. Now, the 6 pillars of wellness, which I hope that you have a clear concept of before you leave. The first pillar is a whole food, plant-predominant diet. The second pillar is 150 minutes of exercise every week, 8 hours of restful sleep, some form of stress management, no smoking, alcohol as well, and regular connection to positive people. Now, what I'll be doing over the next half an hour would be to kind of break down each of these 6 pillars. Why is that so important? We know from data that these 6 pillars can stop or reverse the progression of coronary artery disease, end-stage, early-stage prostate cancer, type 2 diabetes, hypertension, some autoimmune diseases, hyperlipidemia, which is basically high cholesterol, obesity, change gene expression of some genes, and lengthen the telomeres, which are basically the process that goes into aging, the aging process. The first pillar is the most important pillar, which is a whole food plant predominant diet. Now, what it is basically trying to get those 6 servings of fruits and vegetables a day, which is what the WHO recommends. Having a diet that is predominantly made of whole foods, unprocessed foods, grains, plant sources, lentils, legumes, nuts, seeds, and I'll specify more herbs, spices, and all that. These are the things that kind of encompass a plant predominant diet. Now, I'll break down what do we mean by whole food. So the Brazilian nutritional scientists kind of devised this NOVA stage of classification of foods. And what it is basically dividing foods into 4 categories. Group 1 is where you have minimally processed foods, which is basically the fresh, dry, frozen vegetables, grains, legumes, nuts and seeds. Second is where you have the plant oils, the olive oil, the animal fats, sugar, maple syrup. Group 3 is where you have the minimally processed foods, and group 4 is where you have those ultra-processed foods. And really amongst all these 4 things, the one thing that we got to stay away from are these ultra-processed foods, because they are probably the most dangerous things that we're doing to our bodies. Now, to give you an example of what do I mean by ultra-processed foods, you take the example of apples, right? Apples are minimally processed, but when you step into apple juice, that's processed. And when you go into apple pie, that's just no nutrition. That's got no nutritional value at all. It's tasty for sure, but it's got no nutritional value. So that's an example of an ultra-processed food. The sad truth is that 73% of our food supply is made out of ultra-processed foods, 73%. And what we know from research is, over the past 20, 30 years, our food consumption, our ultra-processed food consumption as a percentage of our calories has gone up from 53% to 57%. So 60% of our food right now, as of today, is made out of ultra-processed food. And what we know from data is that this ultra-processed food is responsible for heart disease, strokes, cancers, dementia. In fact, there was a recent study a week back I saw about where they divided folks into 4 quartiles, 4 groups. And what they did was they compared the amount of colon cancer prevalence amongst these 4 groups. The difference between the first quarter, which was having the most amount of ultra-processed foods, versus the lowest, was about 40%. So that's how much your risk of colon cancer goes up with these ultra-processed foods. So it really is a double whammy for our bodies. And why do I say that? Fruits, vegetables, grains, they inherently are nutritious for our body. They have inherent tocopherols, polyphenols. These are things that are really nutritious for our body and prevent a lot of these diseases that we talk about. So by going down the route of ultra-processed foods, we're not just denying ourselves of these incredible nutrients, we're actually giving all these toxins that go into our bodies. So that's the gist of the whole food thing. The whole idea of having whole foods is to have as less processed foods as you can. The next big benefit of a plant-based diet is the fiber. Fiber is our best friend. We have to include as much fiber in our diets. The WHO, CDC, they all recommend about 35 to 40 grams of fiber a day. Guess how many Americans get that today? 11%. 11% of Americans get the desired amount of fiber in our diet. And there's actually data showing as your fiber content decreases, your colon cancer risk increases. Same thing goes for CKD, the chronic kidney disease, coronary artery disease. It's proportional. So and it's easy. The good thing is that fiber is really easy to get. I mean, all plants, all vegetables have fiber. Animals, by definition, do not have fiber. There's no fiber in animal content. So now I want to reassure folks that I'm not talking about going veganism. I'm not talking about going vegetarianism overnight. In fact, if some of you might have known about these, might know about these 5 blue zones, which are basically 5 areas in the world where the average life expectancy is 8 to 10 years higher than the typical American. Nicoya Peninsula in Costa Rica, Sardinia in Italy, Ikea in Greece, and Okinawa Island in Japan. And there are some rural areas in China as well. Now, these researchers, what they did was that they went and lived in these areas for a month at a time, for a month or 2 at a time, trying to find out what's different, why is their heart disease risk so low, why are the cancer risks so low? And really the common theme amongst all these 5 or 6 areas was a diet that was predominantly made of whole, unprocessed foods, a lot of legumes, a lot of beans, a lot of fiber. None of them were vegans or anything, but the amount of animal consumption was minimal, 5-10%. If you go to a home in Sardinia in Greece, the amount of chicken or beef is non-existent. Red meat is non-existent, but the amount of chicken or even turkey would be really minimal. Maybe once a week they might have. The rest of the meals are really all these whole grains, salads, greens, nuts, and all that. And you might wonder why Loma Linda is on that map. And the reason for that is Loma Linda is actually the center of the Seventh-day Adventist Church. And the Seventh-day Adventist Church, by their belief, they believe in having a diet that is predominantly made of the foods that we just discussed. So again, this is not about going 100% vegan. I don't think that's sustainable. I don't think it's possible. If you can do it, well and good, but I just don't think it's sustainable. But even if you can get to a 90%, 85% or 90% of your diet is made of what we just talked about, that itself is highly consequential. The next pillar of lifestyle medicine is exercise. Right? We know exercise is the best medicine. There is nothing close to exercise. And this flyer, which you're going to find outside, is from the CDC, which basically talks about the immediate benefits of exercise and the long-term benefits of exercise. The immediate benefits of exercise is it improves your sleep quality. It's directly linked to less anxiety, stress, blood pressure. Your blood pressure drops almost immediately after every session of exercise. The long-term benefits of exercise are brain health, heart health, cancer prevention, healthy weight, bone strength, and balance and coordination. Now, the third pillar that we talked about food, we talked about exercise, about the benefits of exercise. What about sleep? And sleep is something that we just don't talk about enough, right? It's kind of a forgotten frontier. We just don't talk about enough. We limit our sleep discussion to sleep apnea. But when we're talking about sleep, we're talking about the length of sleep, the depth of sleep. Are you waking up refreshed in the morning? Are you getting those good 7 to 8 hours of restful sleep? Because that is incredibly consequential. Because we know, again, from researchers that if you're not getting those 7-8 hours of good restful sleep, your risk of diabetes goes up. Your stroke risk, as the slide says, when you sleep 6 hours or less, your chance of a stroke goes up by 4 times, right? So higher levels of anxiety. Anxiety, stress, and sleep are like brothers. They go together. If you're not sleeping well, you will have more anxiety, more stress. Impaired cognition, increased symptoms of depression, as we talked about. Breast cancer. There's research showing if you're not sleeping well, you are at an increased risk for breast cancer, increased risk for heart disease, weight gain. So my mouth is drying up. I gotta get. Now, when it comes to obesity, sleep loss is extremely important. Because what we know from research is that when you're not getting those 7-8 hours of restful sleep, they cause kind of a vicious cycle. It causes a vicious cycle of these hormones, which are so important when it comes to weight loss and weight gain. It causes this cascade of low leptin, high ghrelin, which are basically hormones which lead to obesity, and then obesity leads to more fatigue, and then you end up in a vicious cycle. So sleep, the point I'm trying to make is that sleep is extremely important, and we have to prioritize that sleep. It's so important that after 30 years, the first time in 30 years, the American Heart Association actually added sleep to the checklist that all of us should be asking patients on. So it's really as important as diabetes, blood pressure. In fact, there was a study that they did in 2020, which kind of created a bit of an earthquake in the cardiology field. Why? Because they found that sleep was an independent risk factor for heart disease. And what does that mean? So you could be having no diabetes, no blood pressure, no cholesterol, no traditional risk factors. But if your sleep is not good, you're not sleeping well, that is an independent risk factor for heart disease. So that's how important that study was, and that's the reason why after 30 years, the first new risk factor was sleep. The American Heart Association added that to their checklist. The good news is 40% of insomnia and sleep issues can be sorted out with just sleep hygiene, the whole concept of sleep hygiene, right? There was we know from over the past 20 years since these smartphones and iPads have come along, we know that's correlated with the amount of sleep decline and sleep issues that folks are having. And really, just by doing these few things that you'll find on this slide, and there are some resources at the back as well, just by following these few sleep habits, what we call sleep hygiene, you can solve 40% of your sleep issues. And I personally had this, right? In my residency, we had these night floats where we would do the night duties for a month, and by the end of that 1 month, I just couldn't sleep well, right? I just couldn't sleep well, and there were days when I had to take some melatonin and all that. So again, I went back to my professor who Dr. Parker just mentioned about, and he literally gave me this sheet, and he said, why don't you just fix your sleep hygiene first? And so from the time where I used to be using melatonin to sleep, and now it's you literally in 6 weeks you could see the difference in your sleep quality. Now we talked about food, we talked about exercise, we talked about sleep, and the fourth pillar that I want to talk about is stress management, right? Stress is part of our life. There's no way we can get rid of stress. It is part of our lives. But we can find ways of handling that stress better, because that's the way we handle stress is what affects our heart, our brains, and all that. And this is a saying that's attributed to the father of mindfulness in the U.S. His name is Dr. Jon Kabat-Zinn, and it kind of describes what I'm just going to talk about. The concept of mindfulness and meditation, and it really doesn't. It's not some exotic concept. It's what I'm trying to make clear. It's not something that you need to pick up a yoga mat and go to Turkey Mountain, at the top of Turkey Mountain, and sit and meditate or levitate or anything. That's not what meditation is about. Transcend or go to some other planet. That's not what it is. It is basically just a field that's been rapidly expanding over the past 40 years. And coming from India, this is something that we knew for 3,000 years. This is something that we knew for a long while. But over the past 50 years, we have seen with a tremendous amount of research, functional MRIs and all that, showing the benefits of mindfulness when it comes to our overall health. And just as the slide shows, it just in a multitude of ways it helps us to gain that optimal health that we're talking about. Now, that whole concept of mindfulness is also important when it comes to obesity, diabetes. Why? Because if we apply those concepts of mindfulness to the way we eat, using this concept of mindful eating, that we know again from research has been shown to lead to better diabetes, less obesity, less weight gain, right? Just simple things like sit at a table, love what you eat, drink water, don't rush, take your time. Especially we're multitasking. We are really good at multitasking these days. So you got to focus on what's in front of you. Avoid distractions. Phone, like having a phone in front of you while you're eating. So it really this is the concept that just not just for sleep. It's just for everything across the board. And the way this is a simple concept, right? The 4-7-8 breathing technique, right? Let's say you were at a stressful environment, you had a stressful patient encounter or something. The way you can bring your stress levels down is by just literally practicing this for a couple of minutes. And that's what I did while I was sitting here, just so you know that, because I was a bit anxious. So this is as simple as that. You can do that at home. You can do that when you're having a stressful event at home or at work or anything. Basically just breathing in for 4 seconds, holding your breath for 7 seconds, and then breathing out for 8 seconds. And again, why is that so important? There's science, there's data behind that. The American Heart Association about 3 years back released a scientific statement whereby they encourage the physicians to talk about the benefits of mindfulness and meditation with regard to cardiovascular risk reduction. And it really doesn't, we're not talking about just meditation. It could be anything that you feel is good for your stress level. It could be prayer, right? It could be a walk in nature. Yeah? There's research on showing actually that if you take a walk in nature, that brings your stress levels down by about 30%. Right? So it doesn't need to be meditation. Just find something that it's going to help you. Exercise. Folks who exercise more, as we talked about, have less stress levels. So it's really kind of everything that we're talking about these things are interconnected. So we talked about food, we talked about exercise, we talked about sleep, and we talked about stress management, and the fifth pillar is positive connections, right? We these past few years after COVID, we know we need those social connections. We need to be able to see people. We need to be able to meet people. And not Facebook, not Twitter, not Instagram. This picture is actually from Okinawa Island, right? And they have this concept called Moai, which is basically every day, every village, the elders, the men, the women, they would sit together and they would basically just chat, just gossip. That's all they do. But the idea is to have that connection with people, right? Not through social media. Social media is great, wonderful. There are lots of benefits of social media, but you can't rely on that for social connections. And why is that so important? We know, again, data shows the more time you're spending on social media. There's the study done in UK. What they found was the more time you spend on social media, the more likely that you're going to be depressed, which I'm sure all of us have experienced that. I know for sure I've experienced that. It's just so much of negativity on social media. So again, the gist of what I'm saying is to be able to, so practically speaking, what does that mean? Maybe it's volunteering at your church. It could be a soup kitchen. It could be joining a book club or a music class. These are things which kind of cover that pillar. And the last pillar of lifestyle medicine, I'm not going to dwell much on smoking because we know the harms of smoking, but alcohol is again is a causal factor for almost 60 medical conditions. As you see in the slide: depression, stroke, cancers, memory loss, breast cancer, heart disease, gastritis, pancreatitis. The list goes on. The list goes on with alcohol. In fact, about a month back, the Canadian health authorities released their alcohol guidelines, and what they suggest is having as less alcohol as possible. So that concept of moderate alcohol intake, that's gone out of the Canadian guidelines. And it's right now the Canadian guidelines say as less alcohol as you can. Now, we've talked about these 6 pillars, right? The 6 pillars of lifestyle medicine. Now, over the next few slides, what I'm going to do is discuss how these 6 pillars are related to what we just talked about, these lifestyle diseases. This is, on the left side, is what you see is a normal artery. This is an artery that you're born with, a normal, clean, beautiful artery. This is what happens, guess when? About teenagers. So when you are presenting with a heart attack, when you are presenting with a stroke at 60 or 70, that process didn't start 5 years back or 6 months back. This has started way back in your teenagers. So this we know from, in fact, 90% of GIs who died in World War, when they did autopsies on them, 90% of GIs had almost 80% plaque in them, because that's how the theory came along, that this process starts really early. Now, when the next stage is when these problems start creeping up. Inflammation is really the crux, the kind of the funnel for heart attacks. Same thing goes for strokes as well. When you have that perfect storm where the good thing about our bodies is that we have our in it for us to deal with this inflammation. We have our own anti-inflammatory mechanisms to deal with this inflammation. But when the amount of inflammation kind of overwhelms our protective mechanisms, that's when that perfect storm happens, and that's when you have a heart attack, a stroke. Right, when that plaque ruptures and then the body just responds by just shutting out the whole blood vessel. And when we talked about these 6 pillars, each of them is linked to inflammation, right? If you're having, in fact, there is data showing if you're having that McDonald's and an ice cream shake with it, and we check your CRP levels, which is a marker of inflammation, it's almost the same as somebody who's just smoked a cigarette, right? So that's the amount of inflammation with each of those ultra-processed meals that we take. Each time we're doing that, it's inflaming our coronaries each time. And our bodies, as I said, have the ability to handle that, but there are times when it just gets overwhelming, and that's when that heart attack or that stroke happens. Exercise. Half an hour of exercise decreases that inflammation by about 35%. To put that in perspective, that's about the same as the best statin does, the best cholesterol medicine. That's about the same without any of the side effects of that medicine, right? Same thing with sleep. You're not sleeping well, your inflammatory markers will be high. With stress, same thing. If you're not able to handle stress better, that's increasing your inflammatory markers. So we talked about heart disease. Now the next thing would be brain disease, right? Dementia. 60% of dementia is from Alzheimer's. 17% is vascular dementia. Now there is this common thought that Alzheimer's runs in my family. My dad had Alzheimer's, I'm going to have Alzheimer's. No, that's not true. 7% of Alzheimer's is familial, genetic, right? 7%. So 93% that gives you hope, that 93% of Alzheimer's is within our hands. We can prevent that. It's not written in our genes, right? So that's how consequential these choices are. Now, this study done at Rush University, what they found was the MIND diet, which is basically a whole food, plant-based diet, significantly protects you against Alzheimer's disease to the extent of 40%. So your risk of getting Alzheimer's drops by 40% when you switch your dietary habits to what we just talked about. In fact, what they found was when they looked at a single diet component, which is basically green leafy vegetables, and they kind of divided them into groups, the folks who had the most amount of green vegetables, their brains were 19 years younger than the folks who were not, who were in the least amount of green leafy vegetables. Dr. Aisha Sharzai and Dr. Dean Sharzai are two neurologists at Loma Linda University. Their life's work is Alzheimer's disease. That's all they do. That's all they do day and night. And what they're coined this term called the Neuro 9, which is basically greens, beans and vegetables, cruciferous veggies, which are basically broccoli, cabbage, things like that, seeds, nuts, berries, ginger, green tea, and whole grains. So these are the things that we want you to incorporate more in your food habits every day. What about exercise? It's so consequential that there was a study in Australia where they divided 5,000 patients into two groups, 2,500, and they basically asked one group to just walk, just brisk walk, 25 minutes, brisk walk, right? And they followed them for 10 years. And what they found was the folks who just had a brisk walk, no fancy gym, nothing, no gym equipment, just a brisk walk, the risk of dementia was decreased by 45%, right? Just by that walk. Same thing goes for meditation, mindfulness that we just talked about. There's data showing that when you practice these mindfulness techniques that we talked about, there's actually at a molecular level, you can see a difference in certain parts of the brain that are associated with Alzheimer's. Yeah, this to give you perspective about how expensive Alzheimer's treatment can be. So a couple of years back, I guess I'm not supposed to say company. They released this enzyme, this medicine called Aduhelm. The cost of this medicine is $56,000 a year. $56,000 a year. So it was for the first time in 25 years, Medicare was thinking about raising the premiums because of just one medicine. So they created a big outrage and all that, and then so the company said, you know what, 56,000 is too much. Let's just bring it down to 28,000. So made it 28,000, and finally it still created so much outrage that it's been put on the back burner. But just to give you an example of how expensive Alzheimer's treatment can be, when we have a much better solution, as we just talked about, 45% with just half an hour of exercise, right? So that was, we talked about heart disease, we talked about strokes and dementia, and so this is the home slide of the American Institute of Cancer Research. basically exhorting us to have a diet rich in whole grains, vegetables, fruits, and beans. Why is that so? Because plant foods, as this slide shows, affects cancer progression and cancer initiation at every stage. So when you are switching your diets to a more plant-predominant diet, you're not just decreasing your risk of the initiation of cancer, you're also decreasing the risk of, if you have cancer, you're decreasing the progression of that cancer. So that's how consequential these food habits are. I love this slide because this really tells us about how good our bodies are in dealing with these diseases that we talked about. So what you see on that X, on the horizontal line is basically these enzymes that are anti-cancerous, okay? And NK cells that you see on top, the NK cell, it's a short form for natural killer cells, okay? Now what are these natural killer cells? They're basically small little sentinels that are basically circulating around your body 24/7. They're just circulating all 24/7, and they're literally looking out for, is there any cell that's precancerous, that's kind of misbehaving? So the moment it sees that misbehaving cell, it just zaps it down. Right? So we have this mechanism within our bodies to protect ourselves from cancers. So each time, what these researchers at the University of Arizona did was they kind of mapped out what's the level of these NK cells with each bout of exercise. Each time you exercise with that brisk walk, you are increasing those levels of NK cells by 5 times. 5 times. So that's how you know when you exercise, you have a 25% less risk of cancers and all kinds of cancers, basically. So as I said, we have it in our bodies itself to deal with these issues. Now, this is a slide that really gets me excited. Why? Because you see a lot of patients who say, this runs in my family. Heart disease runs in my family. Cancers run in my family. Dr. Dean Ornish is considered to be the father of lifestyle medicine. He is a professor a cardiologist at UCLA. And what this is basically a gene expression, a test of gene expression. Our bodies are made out of thousands and thousands of genes. What he showed was with 3 weeks, just 3 weeks of basically switching your habits, your lifestyle habits to a more whole food, plant predominant diet, exercise, sleeping. What they're basically being able to show is that you're able to turn off 500 of these pro-cancerous genes that we were born with. Our bodies have genes that are pro-cancerous as well. So with these few weeks of these exercise dietary habits that we just discussed, our own bodies were able to turn off 500 of these genes. 500 of these genes. So the red is where you see all these genes all lit up, and green is when those genes are just getting switched off. They call the RAS oncogenes. But basically, what this is basically a confirmation as to this is the mechanism for how exercise, diet changes our risk for these cancers. Now, we've all seen that 90-year-old or 95-year-old lady, sprightly lady who walks into the office, and we all want to age gracefully, right? Aging is also related to these lifestyle changes. In fact, Dr. Ornish, what he showed was the process of aging is actually determined by this enzyme called telomerase. And what is telomerase? It's basically an enzyme which repairs genes. Our genes have these mechanisms, these enzymes, which kind of repair these genes if they get damaged because of that smoking, because of the fast food, the stress, and all that. But this enzyme telomerase, if it sees that gene getting damaged, it goes and repairs it. And what he demonstrated was with these lifestyle changes, you're actually increasing the levels of this telomerase enzyme. So that again was quite a monumental finding. It was about 9 or 10 years back. Now I frequently get this question: is it too late? Right? Like, is it too late? And that's why I'm so excited about lifestyle medicine. It's never too late. It's just never too late, right? Again, Dr. Ornish, 30 years back, what did he show in this? On the left side is what you see is in angiogram results of folks who were pre-intervention and post-intervention. So you see that with a few weeks of lifestyle changes, a few months of lifestyle changes, you see that curve split, and that the diameter of your coronaries start getting better, start improving just with these few months of lifestyle changes. And what you see on the right side is that blockage, that blue spot there that you see, that's no blood. You're not getting any blood there. And red is where you see the blood. this is with few weeks and just a few weeks of switching your diet, having more exercise. So again, it goes back to what I was saying. We have it in our bodies to kind of deal with these issues. Now, you would say, like, have you seen it in person? Yes, I have seen it in person. I want to share one of my patient stories. This is a patient who was referred to us from an outside hospital. He has had a history of a bypass. He's had a bypass, and he's had about 10 stents, and he gets an angiogram about every 6 months. So every 6 months, he comes in with chest pain, and the angiograms are done, and the stent is clogged up, and we balloon it. So one of these times he presented to our hospital, and then so we did this angiogram and I had no space to do anything. There was no space for me to do another stent or another balloon. It was just completely clogged up. So I went outside and I again spoke to the same thing, and we got to change the way we eat, and he was diabetic as well. So he said, you know what, this is it. I'm not going to do this anymore. Just tell us what I need to do. And this is a note from one of his providers a few weeks back, and this is we'd done the angiogram about 8 to 9 months back. From an A1C of 10, his A1C has now dropped down to 5.9. He's lost 30 pounds, and this is a patient who could not walk across the room without taking a nitro pill, right? And he has completed cardiac rehab, and he's walking an hour on a treadmill at cardiac rehab, and he plans to continue that. Once he finishes the rehab, he wants to go along with that. So that is the effect of these changes that we just talked about. Now, there's another patient who was able to get off insulin with these things. And coming back to the patient that we just talked about, Jody, right? So this was his cholesterol before he started embarked on these lifestyle changes of exercise, sleep, and all that. And this is basically in 3 months, right? Or you see where those cholesterol numbers have dropped in basically 3 months. I can talk a whole lot about this, keep on going on, but I want you to hear it from Dawn herself.
My husband came in, we found out he had the Widowmaker. And if I heard Widowmaker from the staff one more time, I thought I was going to heap up into a pile and cry my eyes out forever. And Dr. Joseph took him to the cath lab, and he gave me this book. And he said, read it. And I read it. And I took my husband home. My husband has been raised on a dairy farm all of his life, meat and potatoes.
He's right now in Arkansas. He's driving.
Yeah, he's driving right now. And I immediately switched him to a plant-based diet overnight. He was not a pleasant human being to live with at all. He was grouchy, he was mad, he was angry because his job is very physically demanding, and he was mad that he was a heart patient. He was angry. I switched him directly over to plant-based. I was feeding him stuff, and he would look at it, and he's like, I'm not eating it. Fine, you're not eating. Like, I'm not cooking you anything else. So we ended up back in the hospital. I was like, oh my gosh, we're going through this again. I was scared to death, and it was stressed. It was all stress. He was all worried and panicked and all this stuff, and he said, you need to meditate. And I'm like, you're telling my farm boy husband to meditate. And he believes in this man so much that he did. He meditates every morning for 45 minutes before he goes to work. And like you said, it's not on a yoga mat. It's out in our backyard. We live out in the country. He listens to everything come alive in the morning. And then last year, I ended up in cath lab.
So the story gets a bit of a twist there, right? So about a year later, so I get a message from Dawn, like, Dr. Joseph, my side message. I'm having some chest pressure, some pains. I'm like, Dawn, just walk in, just come to the office. So I said, you know what, you're having some pain, let's do a stress test. So a week later, she goes in for the stress test. So whenever you get a call from the stress lab, it's always a bad sign. It's always a bad sign. So the stress lab folks called me and saying, Dr. Joseph, I don't think we can do the stress test. She's having a lot of ST changes. We talked about those EKGs just sagging down. and they found it too risky for her to complete the stress test. So we obviously we stopped the stress test. We got her back in, and we said, you know what, we need to do an angiogram today. And so we got her in the hospital. We did an angiogram, and guess what? Clean, beautiful blood vessels. So what it was basically when we came out was the amount of stress that she was under. Right? She was under significant stress, and you can talk more about that.
So, and I was really surprised because I've been doing this animal plant diet and all of this stuff and everything, and I learned how much stress can do to a heart, especially to a woman. So I have been seeing a therapist through St. Francis for well over a year. Started out 3 times a week, and now I'm just down to a month. She has learned and taught me immensely how to deal with the stress and my faith. And obviously, this man here has taught us so much on eating. And there will be times you fail. This is hard. This is hard work. And you're going to fail. You're going to want that fried egg. You're going to want that steak. Fail. Because if you don't, you'll never make it through this. You have to do it, and then you have to get back on. And the sleep thing is another huge issue, and I know every one of you out there's got a cell phone. And it's got some kind of health focus, sleep focus program. Both of our phones are set up, and they remind us 45 minutes before bedtime, like we're little kids. We start winding down, everything gets turned off. TVs, everything gets turned off. We play this meditating music on our Alexa. We go to bed at the same time every night. Depending on my husband's schedule, we get up roughly about the same time. And we've managed a ton of stress. Dr. Joseph has been a huge help because him and I were both going through about the same thing with some family issues and stuff. It can be done. But you have to work the program. And there's some stuff, and you will make it, and you will be like, maybe not. Dr. Joseph and I have talked a lot about spices. It's amazing what you can do with spices and add them to vegetables, throw them on the grill, and you'll be like, wow, that was great. Sleep, manage your stress, lean on your friends, lean on your family, lean on your faith, and find the best damn cardiologist in this town.
So as I said, I don't think we can complete the length and breadth of lifestyle medicine in an hour. So what I have here is a few resources that you can take along and build your own skill set, right? Some of these books, one of them is called Undo It by Dean Ornish. The next one's called How Not to Die by, easy to remember, Dr. Michael Greger. Prevent and Reverse Heart Disease by Dr. Caldwell Esselstyn, who's actually a surgeon at the Cleveland Clinic, and he runs the heart disease clinic there. Folks who have issues with sleep, there's this really good program, a 6-week program by Dr. Greg Jacobs. He runs a sleep clinic at Harvard. And this book is basically a 6-week program where at the end of 6 weeks, what he's shown is that 97% of folks who had sleep issues and were on sleeping pills, 97% of them got off sleeping pills by following that 6-week program. But lifestyle changes, habit changes are difficult, right? As she just talked about, these are difficult. And this book that I mentioned here, One Small Step Can Change Your Life, is by a really renowned psychologist, Dr. Robert Moore. He talks about how can we get these habit changes in? How can we get these habit changes into our lives? If you're interested in mindfulness, this is a good book for mindfulness by Dr. John Kabat-Zinn, and another book by him, Full Catastrophic Living. That's a really good book by him as well. Now, some websites that I highly recommend. One is called Full Plate Living. This is actually by an organization right here in Oklahoma. It's the Ardmore Institute of Health. It's run by a philanthropic organization. This is a wonderful resource. You have meal plans, you have recipes, everything that you can think of is on that. You can join for a free program. Nutritionfacts.org is a really good website where if you're bored, just go on there. 5-minute bite-sized videos on what's the data on eggs, what's the data on meat, what's the data on this and that. Really small little videos. Lifestylemedicine.org if you need resources for your patients, for your offices, that's a really good resource. For stress management, Mindful Leader is a good website. Mindful.org is a good website. Certain apps are really good. I personally love Simple Habit. It's a really easy to use app that you can use for mindfulness, for stress management. Calm, Headspace, these are just some apps that you can think of using. Now some of you might be thinking, what is St. Francis doing about this, right? And I'm really proud to be part of a hospital that's actually decided to tackle this head on, right? For the past 2 years now, we've been working on a program, and we actually launched the first hospital in the state to have a lifestyle medicine program. So what it is basically we had our first cohort, pilot cohort last fall, and at the Health Zone, where we have a 5-visit program over 9 weeks, where this team led by a physician, a dietitian, a stress management counselor, a professional chef, who's actually here. So, Buck, you want to stand up? So we worked together a lot in building this program. A manager and an exercise physiologist. We meet in a group over 9 weeks, 5 sessions on a Tuesday evening. And basically over 9 weeks, what we do is that try to build skills so that patients can go home and be able to cook at home, right? That's the whole idea. If you know how to cook at home, you will eat less processed foods and all the kinds of things that we just talked about. We have sessions in those 2.5 hours. There's a one-on-one session with an RD about how to do grocery shopping, how to read food labels. Then we have in that 2.5 hours, there's a half an hour with the physician where we talk about a specific topic. We do a deep dive into each of these diseases that we talked about. And we ended, all of this is really overwhelming, so we ended with half an hour of mindfulness. There's a 2-month free membership to the Health Zone while in the program, and there's in the next cohort, we're planning to get specific exercise planning as well, where we would have an exercise physiologist trying to find out what exactly would be the right exercise for so-and-so person. For some person, this might be an exercise bike. For somebody else, might be a recumbent bike. So finding that right equipment and plan for them. You do have logs and reading materials and all that. And this was our first cohort that we just did, and it was a fantastic experience, learning experience for all of us. Really, I want to end with this. The new unifying theory. And what I want you to take back from this presentation is that the reason why all these diseases, these lifestyle changes can prevent and reverse the progression of so many different diseases is that they are basically different manifestations of the same underlying biological mechanism. They're basically manifestations. So what the slide is trying to say is that when you're doing these things, it's not just good for your heart. It's good for your brain. It's good for cancers. It's good for dementia. It's good for these same 6 pillars is good for everything. And it's really, the proof is in the pudding in these folks who live in these areas, right? They have the longest longevity. That's the secret of their success. I want to end with a message of hope, right? In these days, lifestyle medicine is for everyone. It's never too late. It's never too late. And you literally giving your bodies a chance to do the job, right? As we saw in that exercise slide, an example of that. And really being mindful, and when we talked about mindfulness, as I said, it's not about going to Turkey Mountain and meditating there. It's about being mindful in what you're doing, every single choice, every meal that you're eating, being mindful about what you're choosing at your grocery store. And I actually have an example about what I'm just talking about. So, what I have is 2 packets of ramen, right? This is what I lived on when I was in residency, right? This is what I lived on. Now, this is, if you look at the contents for this, right? So it says half a serving. So 1 serving has 760 milligrams of sodium. 760 milligrams of sodium. 1 serving. Okay? And now, you really think you can survive with half a serving, like half a packet of this? So this is actually, the way the deception in this is actually 2 servings. This is 2 servings. So with each pack, you're getting 1.5 grams of sodium, just 1 pack, right? And that's besides the 50 other chemicals that they have. So I really think it's sort of instant. This should be like instant hypertension. That's what they should probably label this as. Now, when you look at that, right? I was just walking past Costco the other day, and what I saw was this pack of ramen, right? This pack of ramen. And if you look at the contents of that, it's got 0 sodium. 0 sodium, right? 0 sodium. double the amount of fiber, right? And like the ingredients are basically brown rice flour and millet flour. That's it. The idea is not about this brand. The idea is about being mindful about what you're buying at the grocery store, looking at the labels, making sure that you are looking at what you're buying, right? So that's an example of being mindful. So that's just an example that I thought I'd give you. And having, as Jody said, Don said, was about being curious, being inquisitive about these tastes, the new tastes that you're going to feel. You're going to experiment with new spices, new herbs, new vegetables. You might not like them, but give your taste buds a chance, right? Explore these things. It might take a few weeks for you to get adjusted to those things, but give your bodies a chance to get adjusted to that. And really, the more the better. It's not an all-out thing, right? As I said, it's not about going vegan and running a marathon. No, that's not the idea. It's about small steps and just moving in that direction. And I want to reemphasize one thing, that these changes that we just talked about are not a substitute for medical therapy, right? I still did that stent for Jody. I didn't say, go home and eat broccoli. Right? We still got to do that stent, but that's not just the treatment. You have to combine these treatments, these medicines that we give as providers. You got to combine them with these changes that we talked about, because that is the foundation. If your foundation is not strong, everything else crumbles. And wellness it's a journey. It's not a destination. You're not. The way I tell my folks, the patients are, it's a marathon. It's not a sprint. Right? You got to pace yourself. You got to go one step at a time. And that journey begins with one step. You got to take it one step at a time. And that book that I told you about, by Dr. Morrow, that's really an incredible book about that, about this saying. Thank you, everybody. And any questions? This is, by the way, this is going to change as well. The Blue Cross in North Carolina is actually reimbursing for food prescriptions now, because they realize that that's the way to get better health. So that's it. Thank you so much.
Thank you, Dr. Joseph. This is great. I know you probably got 1,000 questions. Okay, do you want me to come, or you have loud? Go ahead. Yeah. Next.
So the data on statins are wonderful medicines, especially there's primary prevention and there's secondary prevention. Okay. So when you've had a heart attack, you've had a stroke, that's when you're on a statin, you're on that for secondary prevention. There's good enough data to say that statins are beneficial in that, for sure. There's really good data showing. And even in primary prevention, when you have a lot of risk factors, there is good enough data. But as I said earlier, you cannot just depend on statins. You can't just depend on statins to do all the job. As I said, half an hour of exercise gives the same benefit as a statin. That doesn't mean stopping the statin. It just means that you're going to potentiate and make that statin stronger when you're doing that half an hour of exercise. Any questions?
Yeah, first I'd just like to say thank you very much for leading the path for us towards a more healthy Oklahoma. And I think you just did an incredible job, and I just am so grateful, and I just want you to know that your time is really appreciated.
Thank you.
Thank you. The question I have is, okay, so I used to eat predominantly like the Atkins diet, which now, is the whole low-carb paleo thing.
Right.
And I probably spent 20 years of my life eating that way. And then about maybe 6 years ago, I started to learn about the benefits of the whole food plant-based diet, so I shifted. But the challenge I have is in talking to my friends about it, many who have cardiovascular disease or diabetes, is that they've been trained that, for example, diabetes is all about the carbs.
Right.
And not about, say, the way that Esselstyn and T. Colin Campbell and Greger talk about, where you basically get the fat out of your system.
Right.
So the first thing I'd like to know is if you could address that. And then secondly, the challenge is that I love meat. I just do. And So a lot of my friends do, and they get confused quite a lot when they read Facebook, paleo, low carb, this is the way you need to eat. What about meat? Moderation's important. And I'm just wondering, I hear what you said about the predominant plant-based diet, but I'm wondering if you could address head-on why the evidence is not there for a low-carb, high-meat, cheese, keep just to the broccoli, just to the beans, and the low-carb things. Can you address that so that that's kind of some clarity?
I think there are a few questions in there, but from what I'm trying to understand is, so first off, Atkins, the person who developed, when he collapsed in his bathroom and they did an autopsy on him, he actually had died of heart disease. So he had clogged blood vessels. So I'm so glad that you realized it. As I said, it's really awesome that you did that. The second question about is there data showing that the paleo keto diet, is it harmful? There's actually data from this year's American College of Cardiology. This year's American College, it's the ACC convention that they have. So one of the big late-breaking trials that they presented was a Canadian study where they showed that folks who are on the so-called keto paleo diet, and they compared them to a whole food plant-based diet, the difference in risk was 50%. So your risk is actually, so there's actually even data showing that's, to answer your question, there's actually even data showing that your risk of heart disease goes up by 50% when you compare those two diets. Does that answer your question? No? Okay.
Yes, sir. Yes, sir. So what you're saying is if you eat meat, drink milk, eat cheese, and you have a regular diet of that, and you also incorporate vegetables and fruits, you have a wide variety, your risk of cardiovascular disease is still higher because you have those animal fats, correct?
I'm sorry, I didn't answer your question.
Basically, she's saying if you eat a full diet with meat, cheeses, those types of things, your risk is higher because of the animal fats and the inflammation that those cause as opposed to.
So the idea is when you are switching, when you're moving, it's a spectrum. It's a spectrum, right? The more you're having your diet is more animal-based, the more your risk is. So it's not, there's no absolute, there's no all or none kind of a thing. It's just basically a spectrum. So as I said, those 6 areas in the world where heart disease is the lowest, none of those places are vegans or anything of that sort, right? They still have some occasional meat and all that. They have eggs. They still have chicken and all that. None of them are vegans, but the amount of animal consumption is probably 5 to 10%. So that is what we know from data is that the optimal diet. Does that answer your question? Or?
Yes, sir. So we're still eating cheese. My dad was a Marine, and he would cook in the Marine, he would cook. So we ate a lot. We ate a lot of meat. We ate a lot of dairy, cheese. So growing up, I always had that. But now I don't eat as much meat, which is strange, but I just don't care for that much. I still eat some chicken, maybe a little beef, and I eat a lot of fish. And I eat a lot of cheese, and I drink like a gallon of milk a week. So fast.
So
I eat yogurt. And I've done that for years and years and years. And I don't feel like
So specifically about your question about, I can answer about the dairy part of it as well. With women, I was talking about a few areas in China where the amount of the prevalence of breast cancer is almost 1/10 as it is compared to the standard American population. What they found was the most incriminating factor was the amount of dairy that they were taking. In fact, breast cancer is directly linked to the amount of estrogen exposure that you have in your lifespan. What they found was folks who live in those areas in rural China, the amount of estrogen exposure that they were having compared to this is actually a British study. So the typical British woman, which is pretty much what our food habits are, the typical British woman's estrogen exposure over a 40, 50-year lifespan was about 500% more than that rural Chinese population. and that directly correlates with your breast cancer risk. So I just want to talk about that breast cancer risk.
I have a question.
Yeah.
Eggs. I'm confused. 20 years ago, we weren't supposed to eat any eggs. Then we could eat egg whites, but not
Right.
the yellows. Then, in Weight Watchers, eggs are
Yeah.
0. You can eat all the eggs you want. Now, I read in your booklet, eggs are out again.
They're not out again. They were always out. They were always out. They were always out, and the reason for why I say that is because when we look at research, we got to look at where is that research coming from, right? Over the past 30, 40 years, a lot of research that was done on eggs was actually sponsored by the American Egg Board, right? So that you got to take that with a pinch of salt. And I knew this question would come, so I did have some supplemental slides as well. All right, so this is a study that was from last year, right? Last year. This is basically a study done in the American Heart Association Journal, which is considered quite prestigious. And what they did was 30,000 Finnish men in Finland. Okay, they tracked these men over 10, 20 years. Okay, and what they found was, and this is considered to be the most well done study because it's a systematic review. It's basically the highest echelon of research. And what they found was egg consumption is directly linked to heart disease and strokes. Directly linked. So the more eggs you're having, the more strokes you're having, the more heart disease you're having. So again, it comes back to the point. You're not talking about going. I love eggs. Right? I have an egg once in maybe a week. I would have an egg. Once in 2 weeks, I might have an egg. It's not about going vegan. I want to keep re-emphasizing that. The moment you start making shifts to your food habits of having more legumes, more beans, more oatmeal, more nuts, more seeds, more salads, automatically your diet switches in that direction. You crowd out the things that are bad for our health. It's not an all or none thing. You're crowding out the things that you were not eating. I come from the southern part of India. I grew up on beef. Beef, chicken, eggs were part of my food habits every day. And this process that I was telling you about, it didn't happen overnight. It's taken like 4 years for me to get to a point where we, as a family, eat the way we are. So you don't want to look at it as I said, a sprint. It's a marathon.
I have one question that was passed to me, and then I'm going to hand the mic over to Dr. Gadraju. So is sleep induced by or helped with melatonin or Ambien not good sleep? Or are you speaking mostly of sleep without any help?
Yeah, obviously the best way to sleep is without these medicines. Yeah, without these medicines. In fact, the book that I just quoted on that book there, 97% of folks who completed that program, 97% of them actually were able to get off melatonin, and I'm actually a witness to that because I did the program. So that's the benefits of you want to incorporate less of these extraneous chemicals and compounds as much as possible. So the answer to the question is yes, of course. If you can get your sleep hygiene or your sleep quality, your sleep length without melatonin and Ambien, that's obviously the best.
Hey, Dr. Joseph. Very good presentation. Thank you. I want to introduce myself to the crowd here. I'm Dr. Gary Raju. I'm one of the cardiologists, and I'm in the same office where Dr. Joseph works, and the two of us came here together. And Joseph has incredibly changed my life. You think physicians know everything. I went to the top, schools around. I did my preventive cardiology fellowship at Brigham, which is the Harvard system. And I worked with Michael Gaziano, who is the leader of Aspirin for primary prevention. But until I came here, I'm a meat eater. I grew up eating meat, and my wife still teases me today, what's this change? You can't have a meal without meat. And once I came here, Joseph and me started off together, and we meet almost every day. We talk about patients, we talk about our lifestyles, and he changed my life. And now, I rarely eat meat. And I preach that to my patients too. And I got into lifestyle medicine because of him. And now I'm 90% vegan. Like many of you here, you might think, oh, that's not possible. How can I grew up eating meat? How can I just give it away? And we're not saying to give away everything, but make that transition. And I have high cholesterol, and you might think the cardiologist here having high cholesterol, he might be on statins, and I have some questions here about statins. And like Dr. Joseph said, primary prevention, when I don't have any other risk factors, I don't need to take statin, right? So I met my primary care provider, and then I just followed what he said. He wakes me up at 5 a.m. or 6 a.m. to do exercise or meditation with him, and the two of us does it on our Apple Watch, seeing each other. And also, I followed a lot of lifestyle changes in terms of diet. And my cholesterol has gone down by 50% in the last 1-2 years without any medicines. So yes, we do preach, we do talk to patients about medications, but that is when they have a strong indication. We say, hey, you need statin. You can do lifestyle medicine, but you start statin and we can always cut down on the dose. As in the next 6 months, if you do better with your numbers, we'll cut down on the dose. If you do even better, we'll take it off. We're not here to say you need to be stuck with statins, but like you said, if there is a lifestyle change, it's a transition, when it comes to that point, we can always get you off medications. But the reason I took over the mic is just to support Dr. Joseph, and he has been through this journey for 3.5 years. The both of us came here together. He felt that there's no lifestyle medicine program in the state of Oklahoma. He spent countless hours in bringing this program together. And if there is any one person here, and the administration has been so supportive of him. So Dr. Joseph, my question to you is, there are a lot of folks here who are motivated, but then they say, hey, is there anything to follow up? Is there a program, or is there any resource, and is there any follow-up? So that's my question to you. How can folks around here follow up with this program?
So as this is the first program in the state, and we right now we just completed one pilot cohort, and lots of logistical issues, the first class, of course, as it is, but things smoothened out. And our hope is to offer this program that we've created to our employees first, and then branch it out more and more, and eventually the whole community, the whole city. Obviously, it's a complex. Building something is complex, and it's going to go in stages. But my hope is that over the next 3-4 years, this is offered to anybody who can walk in.
Couple more questions?
Yeah.
All right, well, I don't want to follow that, but I do have a quick question. Do you want to talk about organic versus non-organic produce and what the research says?
Yeah. So the example that I like to give is for blueberries. The example of blueberries, right? Blueberries are one of the best fruits that you can have every day. So what we do at our home is that my wife every day, and the other thing I was going to talk about is, how do you incorporate these fruits and vegetables more in your diet? By keeping it visible. You have to keep it visible, right? That's the first step. So what we have a habit that we do in our house is, every day in the morning, my wife would get this tray out of fruits and vegetables and all that, and just put it out there. So what happens is that by the end of the day, that tray is done. That's gone, because the kids are walking about playing, they grab some blueberries, they grab some carrots and all that. So to answer your question, the example of blueberries is because what we know from research is that you can have your blueberries organic or non-organic, frozen, unfrozen, you're still getting so much of those benefits just by having them. So when you compare that to, let's say, a donut, right? Right? So there is that stark difference that you get when you compare that. So to answer your question, overall, in the bigger scheme of things, I really don't feel that it matters. It really matters about if you're getting those 6 servings of fruits and vegetables, those grains and all in your diet.
I guess playing off that a little bit, I think I hear from some of my patients, they worry about the cost. Like,
Yeah.
well, if I have to go to Whole
Great
Foods
question.
or
Yeah.
natural grocers, it's so expensive.
Great question. So there are two. You want to look at it in two ways, right? First off, we know that look at, I'm not bought bacon in a long while, but I know that the prices of bacon have gone up tremendously, right? So same thing for all processed meats and all that, right? So I think that is a misconception. If, let's say, for example, when I talked about legumes are probably the best thing that you can get in your diet. Having a bowl of legumes every day decreases your risk of colon cancer by 15 to 18%, right? Well, the cheapest source of protein, that is the cheapest source of protein, right? You can go to your grocery store, Walmart, and buy a bag of chickpeas, dried chickpeas, for like $5 or something, and you can literally use that for the whole week, right? So those are some fears that we have, that having more fruits and vegetables is expensive, but that's actually not true. So that's one side of the thing. And then you got to look at the other aspect of that. the cost, healthcare costs, right? You want to look at healthcare costs. 1/3 of all bankruptcies in the country today are because of healthcare costs, right? So when you put everything into perspective, even if you're spending that extra little bit for that packet of tofu or something, when you look at the long-term expenses of that, there's no comparison. There's no comparison.
Maybe one more question.
I apologize for this, but is Gas X harmful?
I'm not sure about that, but I do know that legumes are really good for guys. Really good. It takes time, but it's really good. Any other questions?
What role is fish
Yeah.
and seafood play?
Oh, great question. I'm glad that you asked that. So, amongst the when you talk about animal protein, I think the thing that you could really have say among the lesser harms is fish. Right? But you also want to know where you're getting your fish from, right? You don't want that farm raised fish. You want as much as possible wild caught, and there's this British study where they took about 50,000, Harvard study actually, 50,000 men and patients, and what they found was when you limit your fish consumption to about 2 portions a week, the harms of all the microplastics, the mercury and the chemicals that go into fish, the benefits of fish outweigh the harm when you limit your fish consumption to about 2 portions a week. And it also depends on how you're eating it, right? You want to bake the fish, right? You don't want to fry it. You want to have it in a healthy way. You want to have, sardines are really good, rich in omega-3s, right? Those are the kind of fish, sardines, salmon. Those are the things that you want to have more. Again, the way you cook it is more important. Where you're getting the fish from, and the portion size, as I said, 2 or 3 portions a week.
Again, thank you guys for coming tonight. Mind, body, and soul, we treat the whole person. And I think definitely we believe in you, Dr. Joseph, and just thankful for the partnership. When he says to surround yourself with positive people, I'm so thankful that you're here with us and for our patients. We'll be here for a little bit if you have anything specific to say, but otherwise, thank you. Go out and be healthy. Appreciate you guys.